Hello, my name is Alessandra Mariano, and I'm a dental laboratory technician for the postgraduate dental clinic. If I could pick one point to emphasize related to my laboratory production, it is that a single lapse in infection control can turn an ordinary task into a source of contamination. Today I'm going to explain how infection control ties into the daily tasks of being a laboratory technician. I've been working here for the past 3 years and have briefed both technicians and doctors at my facility. By the end of the speech, my audience will be informed about how infection control affects the production of prosthetic devices for patients. From handling impressions to maintaining workstations and managing materials, infection control is woven into every corner of the laboratory. To start off, we'll begin with where our cases are found, the patient treatment rooms. Two initial cases we can receive coming directly from patient care are impressions and appliances. Prior to any production handling, it is important to follow disinfection procedures. Impressions coming straight from the treatment rooms follow a strict one-way route to the initial processing room for immediate pouring. My dental clinic specifically has signs on the doors that instructs the assistants to bring their impressions to the correct room. If they happen to walk through the wrong hallway, there are arrows pointing them to the processing room. According to academicpath.org, clinic guidelines often follow for all impressions to be rinsed clear of any debris, saliva, and especially blood. It is then immersed for 5 to 10 minutes in a bag in a 1 to 10 ratio sodium hypochlorite solution. Not only does this ensure 100% disinfection, but it also keeps the impression hydrated to prevent distortion and takes up a huge chunk of the 15-minute window that allows for creating an accurate model from the impression, which emphasizes how important time is. Appliances also follow a route, but they are often handled by the provider unless instructed otherwise. Any appliances coming directly from the patient will be sprayed with cavicide, following a 3-minute disinfection time as stated by the manufacturer's instructions. After disinfection is complete, both impressions and appliances can be rinsed and production can begin. While patient-to-lab contact starts here, infection control also considers how the technician can safely work throughout the case. The laboratory is not 100% safe without personal protective equipment, or PPE. According to the Occupational Safety and Health Administration, OSHA, there is a section for PPE, Section 1910.132, which highlights the use of materials like gloves, masks, eye protection, and gowns. While often used for the patient treatment settings, it's also applied for chemical handling and sterilization in the lab. In the event of contact with hazardous chemicals, all laboratories have a designated area for their safety data sheets, or SDS. SDS is mandated by the International Hazard Communication Standard, IHCS, and are structured based on the Globally Harmonized System, GHS. Materials can be looked up by using their product name, manufacturer name, CAS number, and filtered by letter and what it contains when viewing it digitally via the chemical safety software. There are 16 overall sections, and it starts off with key information on treatment measures, technical scientific data, and what is necessary for the substance to be in compliance. All sections have to be organized by material category for fast retrieval. In the event of chemical spills, labs also have an accessible spill kit, which contains supplies for proper absorption and disposal of the substance. My laboratory has its big spill kit on top of the shelves, and it's hard to miss when you can see a noticeably yellow bin that has bolded letters, spill kit. Additional prevention measures also include having eye wash stations, shower heads, equipment area signs, and weekly maintenance sheets accessible in the lab. This ensures that all areas have operational equipment that can be used to treat certain infections from happening. I personally got to test a shower the other week, and it does send a loud ring across the lab. Funnily enough, to prevent any startling, we just ended up switching to a light signal, but we got to ensure that it works. While being further along the production process reduces the chances of infection from handling, it does not fully eliminate the risk of cross-contamination. It's worth noting that dentistry, like many jobs today, is making a shift towards the digital side. Computer-aided design in manufacturing, CAD/CAM, requires thorough inspection of material quality, adheres to manufacturer instructions to fabricate safe appliances for patients. Cross-contamination is another cause of infection. Having missteps in between processing can get back to the patient if materials are incorrectly used with the equipment. Biocompatibility refers to certain materials that can safely make contact with the body without adverse reactions, according to a definition from a dental directory called Denpedia. It's common to see that a lot of things can be 3D printed nowadays, and of course, dental appliances are no exception. If you recently got a hard night guard or a temporary tooth in place, there's a high chance that it was 3D printed. Non-biocompatible materials are the opposite. They can't be placed into the patient due to their more toxic properties and are primarily used for producing physical models from digital scans. To keep biocompatible and non-biocompatible materials separate, they have their own individual equipment. This prevents any residue from potentially mixing in with the new material. My laboratory specifically labels some parts of machines as bio or non-bio. This ensures that we don't mix any machine parts. We have unfortunately in the past had a few instances of having to clean and reset our printers because the labels weren't read. It's also good practice to consider to wipe down equipment before using it to ensure no leftover material interferes with your next project. In conclusion, infection control plays a critical role in each stage of production in the dental laboratory. It's not just limited to a single step or a member handling the case throughout the process. Disinfection considers safety from patient care to the technician who's receiving impressions and appliances. Those initial 15 minutes are crucial to ensure 100% disinfection and for creating an accurate model. By bringing in the case into the laboratory, technicians can commit to safe practices by knowing how to handle hazardous chemicals. Being fully aware of how to properly use, dispose, and follow up with care helps prevent infections happening for the technicians. Lastly, digital production is still a means of causing cross-contamination. Thoroughly understanding how to use biocompatible and non-biocompatible materials supports infection control. Understanding safety in every step helps guarantee an effective appliance and a successful technician who can fabricate for the needs of the patients. Thank you for listening.